Thanks for coming back to Horse Talk Live. We're here with Dr. Meghan Wintermyer, and we're talking about equine acupuncture and how she's integrated it into her veterinarian practice. So you're 100% on the road, ambulatory in your practice, right? SilverLeaf. And so tell us what an average day for you would be and how much acupuncture you do on a daily basis.
I would say that acupuncture comprises about 80% of my practice. So on a typical day, I could have all acupuncture, or I can have acupuncture and they can say, hey, doc, while you're here, would you mind doing? The thing about acupuncture is it does take a little bit of time. So from getting the history to putting the points in to setting up the electroacupuncture, if you're doing electroacupuncture, it will take an hour to an hour and a half. And I tend to talk a lot, so maybe even 2 hours. So you would want to give yourself enough time.
So how many of your patients are you seeing on a regular basis, or do you go back?
So it all depends. There are some horses that I see weekly. There are some horses that I see every 2 weeks. There are some horses that are out of state that they bring to me that I'm not going to see except for every month or every couple months.
Okay. So you give people kind of a plan after you see them initially, what you think the horse is going to need to follow up with.
Exactly. And every horse is different. So it might be 1 treatment and they're done. It might be 3 treatments and they're done. Or it might be, hey, we really need to do this every few months. Or, hey, your horse has a skin condition that usually starts in the spring. Let's start planning for it in the wintertime so that we can get ahead of it.
And so what would a skin condition be that acupuncture could help?
So the hives, this from insect bite hypersensitivity, would be a really good example of that.
Okay, and so how is the acupuncture actually helping?
I would say it's more that, well, it's a combination of acupuncture and herbs.
Okay.
Because the lung controls the skin, so you're tonifying the lung with the acupuncture, and then you're getting ahead of their inflammatory response with the herbs.
Really? That's so interesting. Okay. Yes. We talked a lot about laminitis. What about navicular, which is another problem a lot of people have to go through?
Yeah, so with acupuncture, you're not going to cure the disease, but you're going to help with the pain. So navicular horses with contracted heels, those are great problems to help the pain of the horse. But you're not going to actually change the navicular bone with acupuncture.
Okay, you'll just help provide relief.
Exactly.
Okay, which, obviously is what that horse would want, so.
Exactly.
And then, like the contracted heels and maybe some other foot conditions, do you help people to decide on, like, some other changes that need to be made in that horse?
Absolutely. I've had cases where people have brought a horse to me that they wanted me to fix a horse with acupuncture, but I just told them, I said, I will acupuncture your horse, I will help them with the pain relief, but we have to do shoeing changes in order to correct the problem.
Okay. And then some other leg issues. I know my horse had some soft tissue issues a while ago.
So acupuncture is great for bow tendons. If you get in there, if they're acute, it's even a better prognosis with acupuncture. Soft tissue injuries, not just the distal limb, but on a lot of horses that are asked to use their hind end a lot, the reiners, the cutters, you name it, we ask them to collect. They have a lot of soft tissue hip pain, and acupuncture is one of the few modalities that actually helps that pain.
Okay, so you can relieve some of the pain by, are you stimulating, like, for like an acute injury?
Yes.
Is it healing it quicker?
Yes.
Okay.
Yes. You can actually, I almost wish that I had a video of it, but to use acupuncture with a bow tendon, you can see that it helps the bow tendon heal quicker.
Is that like at the actual site of injury, or
you would go above and below? And then, so for another example, for combination, if you had a soft tissue injury, say it was infected, I'm not going to just acupuncture it. I'm going to have your horse, I'm going to tell you to put on antibiotics, and then I would do what's called surround the dragon, which is surround the area with the acupuncture needles and to stimulate the body for healing process in that area.
That makes perfect sense.
Okay.
Well, let's watch the last bit of video of you and your work in treating horses to learn more about the different types that you choose to use.
Okay, so this is the horse. I'm hooking up the electrodes, and there's 2 wires that will go to, and eventually you'll see the electroacupuncture unit, and that's where you can set the intensity and the hertz depending on what the condition is. So not that this is specifically for it, but horses that have wobblers, acupuncture is great for it. Horses that have laryngeal hemiplasia, those are both neck problems. Those are not that those specific points would treat those conditions, but acupuncture is great for those conditions. And I'm just basically, it takes me a few minutes. I have to hook the electrodes up, and I just drape them over the horse's back until I get them all on. And then you'll see I will put them in the electroacupuncture unit.
So have you yourself felt the electric?
I treat myself all the time. It's illegal for me to treat any other human except for myself.
And what does it feel like?
It's amazing. It feels just like an electric pulse going through. And if you've ever had back pain, I do have a confession. I've treated my husband. He calls it WD-40 for his back. So for lower back pain, electroacupuncture, and then it's almost like after you've had it done, you keep waiting for the pain to reoccur, but it doesn't.
And then should it reoccur, then you just do another treatment.
Exactly, and that's on Shen. That's the behavioral point. And I hope you can see this horse he's a thoroughbred, and then a little bit you can see how much quieter he is in his eyes and softer. And there's that's acupuncture to stimulate for appetite.
So you're actually injecting?
I am injecting. It's a combination. It's diluted B12, I'll be honest with you. You don't have to use B12. And what that does is you're stimulating the acupuncture point over a longer period of time with acupuncture.
That liquid. Okay, and so yours just said there was some B12 in there. Other types of liquid that you may use?
Yes, I'm sure other practitioners use different substances. Some may use saline.
Okay.
You don't want to do anything that's going to harm the acupuncture point. You just want it to basically stimulate the acupuncture point over a longer period of time.
Okay, and so that one was to stimulate appetite,
yes,
right?
Yes.
Okay, so what are some cases that a horse may not be eating correctly?
Exactly. If you have a geriatric, or it doesn't even have to be a geriatric horse that is inappetent, you can stimulate that point. There's a few other points to stimulate for the appetite. One of them is underneath the tongue, and unfortunately you have to grab the tongue and go underneath, so I rarely use that one.
Yeah. Are there ever cases when you need to sedate a horse in order to treat them? Or?
Actually, that's a great question. You should not sedate a horse because it interrupts the acupuncture process.
Okay.
So
and naturally they get kind of sedate
right.
after.
If there is a cantankerous horse that I need to put a point in and he's not letting me, I may use a twitch. And by the way, a twitch is nothing more than stimulating an acupuncture point.
Really?
Yes.
So explain that a little bit more.
So there are 2 points on the nose, and when you twist the nose, you're actually stimulating those points. So the horse isn't going he's actually going that feels
really
good. Yes.
I had no idea.
Yes, and if you think about it, Anshen is behind the ear, and if you twist the ear, which I never let my assistant do, but you're actually stimulating the acupuncture point.
So it's not pain that you're inflicting.
Well, yes, that's debatable.
Okay. Well, we won't talk about it then. Okay, well, we've known that you are a vet, and then you decided to add acupuncture into your bag of tricks, and now you're even continuing your education further with chiropractics.
And that goes back to Dr. Simpson, and when I saw him do the 2 modalities together, acupuncture and chiropractic, it's amazing what you can do for musculoskeletal problems.
What would you use first, the chiropractic or the acupuncture?
Use both. Use the combination of the 2. So a horse, and it depends on the horse. A horse that you're trying to adjust and you want muscle relaxation, you might do acupuncture first. If it's a horse that's he's painful because he's out of alignment, you will do chiropractic first and then see how he is. Is he still painful? Does he still need that acupuncture treatment?
Okay, so in this case, if somebody just really didn't know what was exactly wrong,
Yes.
they can just call you and you can diagnose.
I could figure it out for you.
Okay, so what are some common musculoskeletal problems that people will have to deal with or do deal with?
So commonly, the horses that have to collect from the back end, whether it's a cutter, reiner, dressage horse, hunter jumper, they have stifle hock problems. Acupuncture will will increase the length of time that those injections are good. And the other problem, I might have already said, and I'm sorry if I repeat it, but a lot of times you'll inject those joints and they still have back pain. So you'll come back and that's the time when acupuncture will really shine.
Okay, again, just
So
working
if you do your hock and your joint and
Yeah.
your stifle injections and your horse is still a little off, that's when you can do your acupuncture.
because one problem,
Leads to, because the way that the horse carries himself when he has hock and stifle pain causes that soft tissue hip pain. And so by acupuncture, we're treating that soft tissue hip pain.
the whole problem. All right, well, our horses are going to love that. If people have questions, we want to let you know that Dr. Wintermyer takes questions on her Facebook page, and they can just type in SilverLeaf Equine.
Yes, and you can call, text, email. I'm available.
Okay. You'll also be hosting webinars, is that true?
Yes, that's true.
Okay, so if folks have any questions, which I'm sure, I know that I'm still full of questions, and you're happy to answer all these questions.
I love talking about acupuncture, so please, anytime.
Well, we appreciate you taking the time out of your busy schedule, and I'm excited to have you out to look over my horses and see if they can benefit from acupuncture. Visit Dr. Wintermyer on her Facebook page or silverleafequine.com for all the information on equine acupuncture. As always, we want to invite you to give us suggestions for Horse Talk Live on our Facebook page and also at horses@rfdtv.com. We appreciate everybody tuning in. Until next time, we'll see you around the barn. Dr. Wintermyer, thanks again for being
Thank you. I had a great time.
All right. Thanks, everybody.